Okay. Hello, my name is Lakila Stokes Bay. Today is 10/18/2025, and I will be performing my skills evaluation for inserting a Foley catheter. Okay. Knock, knock, knock. Hello. Hi, it's your nurse, Lakila. Can I come in? Oop. Oh no. Close it this way. Oop. Hello, hi, how are you? Let me pull the curtain. Well, you can see through the curtain, it's invisible. Let me pull the curtain for some privacy. Hi, how are you? So, my name is Akila. I am your nurse for today. And can you tell me your name? Okay, Miss Tammy, okay. All right, nice to meet you, Miss Tammy. So, I'm coming in because I have a prescription or doctor's order to insert a Foley catheter due to the urinary retention that you have been experiencing. Okay, just let me confirm. Okay, tell me your name again, your birthday. Yes, okay, yep. All right, this is you. Okay, alrighty. So, have you? Oh, first, let me ask you: do you have any allergies? Okay, so no known drug allergies, no known food allergies. Okay, so no allergies to shellfish or iodine. Okay, very good. So, um, first, well, also, let me ask you, have you had a Foley catheter before? No. Okay, so let me just explain it. So basically, this is a uh, so it consists of a bag and some tubing. Okay, so the bag is for the collection of your urine. The tubing, of course, is for the drainage. Okay, and I want to let you know once I get started, you may feel the need to try to touch or move your arms and stuff. Okay, so but I want you to know this is a sterile procedure, so you can't touch it. Okay. Um, and I will be when I insert the catheter, I will be cleaning. Well, first I'm gonna clean you. Okay, I'm just gonna wash you up, and then pat you dry, and then I'm gonna set up my sterile area that you can't touch, and I'm going to clean your vagina with uh, some iodine. Okay, that's to make sure that it's sterile. And we keep it sterile because we don't want to insert any germs because then that'll lead to an infection and a whole host of other problems. So, so I'll be cleaning each side down the middle, and then I'm going to insert a small little tube into your urethra, and it's going to go all the way up to your bladder. And in the bladder, I'm going to blow up a little balloon. You may feel some pressure. Just try to continue to breathe while I'm inserting the Foley, but definitely let me know if you are experiencing any pain. Okay. So the tube is going to go up to the bladder. I'm going to I'm going to inflate the balloon with some normal saline. And yes, right, it's the same stuff that we use for your when we flush the IVs. So it just stays in the balloon, just so it'll hold in place. So the balloon will basically keep it in place, but the urine can still drain through the tubing. And then I just pull it just to check and make sure that it's secure and it's in the right area. Okay, and then the bag. So just in case you try to move or we transfer your stuff, the bag always has to stay below your bladder. Okay, because we don't want anything in the backflow and that type of stuff. And it just works by gravity. So every time your body produces more urine and it goes into your from your kidney and all that stuff down to your bladder and out through the tubing. Okay, so that way we can relieve you of some of that pressure that you've been experiencing, and we don't want any urine, staying there for too long because it's waste. We want it out. So that's what the Foley is for. Okay. Alrighty. So let me clean my hands first. Sorry, I meant to do that when I first came into the room. Okay, First, I'm going to wash you up. Okay. All right. I know you have this gown on. I'm going to fold your sheet back just slightly for right now. Okay. And I'm going to roll your gown up. Okay. I have my basin here. I have my gloves. I have my Foley kit. Okay. I have my hand sanitizer. Okay. Okay, so all right. Oh, let me soap it up real good. Okay. Whoop. Okay. All right. Let me just wash you out. Okay. Can you just open your legs up just a little bit, move them a little bit further apart. I want to make sure I get you nice and clean. Why am I cleaning up here? Okay, it's down here. Okay. Let me wrench in. All right, I'm gonna roll you over. Okay. I'm cleaning the back area. Okay. Alright. Okay. This is just the clean water. I'll wipe you down. Up. Okay, this is the towel too. I'm gonna pat you dry. Okay, roll back over, pat you dry. Okay. Alright, let's set this to the side for right now because I'm gonna clean up some of that excess iodine if there is any. Okay. Alright, let me take these gloves off. Throw them in my trash right here. Let me get another set of gloves. Let me put these on just for leave these on for the sake of the video. I want to use all my cleaning gloves. Okay. So, this is the kit. Okay. I'm going to raise you up a little bit. Okay. I'll make sure you're laying back flat. Okay. I have the proper lighting because I need to be able to see. Very good. Don't want to miss the spot. Okay. Doesn't want to come out the package. All right. This is my trash can over here. Okay. Okay, so I need you to bend your legs. Boop. Boop. Okay. And let your knees kind of flop down to the side. Okay. Like frog legs. Okay. I'm going to set my sterile area up. Should have did that first. I'm sorry. I'm going to set my sterile area up right here. Okay. Place this here. Now I'm going to take these gloves off. My trash can. I'm going to get my sterile gloves. Okay, and you can't touch anything, okay? Alright, I'm picking my gloves up by the cuffs. I hope this is big enough size. I don't have to struggle. Oh, and they're tiny, tiny little gloves. Okay. I just have to be sure to not touch. It's always under the cuff. And then this one, I scoop from the inside. nice. Now, gotta get this right because I don't have any more sterile gloves. Okay. Oh. Or I could pick it up from the inside and throw it. Okay. So I'm going to place this area over here. I meant this apron over here for China because it ensures my sterile field. Gotta make sure the camera can see. Okay. Have everything. Oh, the lube doesn't come in the packet anymore. Oh, this is a new one. They back in the day they used to come in the in just a little packet. Okay, I got my iodine. I have everything. Okay. So I'm gonna open this just to get my sticks ready and exposed for pretend because I don't want to mess it up. I'm going to open my lube. Okay, boop. I'm going to attach my Foley. Excuse me. Attach my syringe to my balloon. Okay, I'm going to take this off. Okay. I'm going to apply some lubricant to this, okay? And the rest I'm going to use on you. Okay. Alrighty, so as I was explaining to you before, I'm going to clean your left and your right side and then of your labia and then down the middle. Okay? Alright, so, and let me know if I'm, if you're uncomfortable or like I'm hurting you as because I have to make sure I hold it back, the skin, your labia back good enough that I expose the meatus, okay? Or the, where your urine comes out from. Okay. Alright. Ready? So I'm going to go get my pinky in on this side, get my thumb in on this side, and I'm going to pull it back nice and good. This is my dominant hand. Okay, I'm going to take one swab and I'm going to go down that side, trash, take the other swab, go down that side, trash. Okay, and I'm going to take the third swab, I'm going to go down the middle. Okay. Alright, I'm going to apply some lubricant. Okay. Now, I'm going to insert the Foley. Just remember to continue to breathe. Let me know if you have any pain. Okay, now I'm going to insert it until I see what we call a flash. And that just means that I'm going to see some urine pop up in a flash as soon as it gets to your bladder. Okay. I'm going to go in 2 inches, well, more than 2 inches, but once I see the flash, I'm going to go in a couple more inches, 2 more inches, okay? Alrighty. Alright, now I already applied the lube, and I got some lube on here. Okay, alrighty. Up, we in, you okay? Okay, I see the flash. Okay, now I'm going to hold it with my dominant hand now that we're in. Going to blow up my balloon. Okay. Oh, we're in there. It's good. You okay? No pain? Okay, good. All right. Now I have to hang this bag down to the side. Okay. Boop. Let's pretend it's on the side. I don't want to drop it on the floor. Then my whole bottle falls off the table. Okay, and Oh, I'm going to secure it with a, oh no, I'm not going to do the leg strap yet. Okay, I'm going to clean this up. Okay, because I got on the iodine. I don't want to mess it up. I'm going to rip it. Okay. Alright. I'm going to clean this up, but technically I'm throwing it away. I'm going to make it nice and neat in case I got to do this over. Okay. This is all going in the trash. The biohazard. Let's just take the whole vagina out. Okay. I just want to move it. So I don't want to mess it up. Okay. Clean up everything. Alright. Well, this isn't here. Okay, technically it's in the trash. The bag is on the side. Let me remove these gloves. Okay. Let me clean my hands again. Some hand sanitizer. I'm going to put on some new gloves. Okay. I'm going to open the leg strap. I'm going to apply your leg strap. Where is it? Right here. Put that through the little hole. Apply your leg strap. Okay. Now I'm going to wash it back up. Just clean some of that off. Some of the iodine. Okay. Alright. Roll over for me. Okay. Alright. Pat dry. These are new clean wash clothes, not the ones I wash off to begin with. Okay. Oh, in the front. Roll back over. In the back. Okay. You can roll back. Okay. Alrighty. Everything is in place. Let me fold your gown back down. Okay, you can relax your legs. Let me fold your sheet and your blanket back up. Your bag is hanging at the side. Just don't want to drop it on the floor. Okay. Alrighty. Let me sit you back up. Would you like to sit up? Okay. Okay, let me lower the bed back down to a safe position. Okay, let me take these gloves off. Alright, throw that in the trash. Let me give you a call bell. Let me give you your remote. Okay, let me turn the light back out. Okay, turn the light out. Okay, call me if you need me. Do you have any questions? No? Okay, good. If you think of any, call me, okay? Okay? I'll be happy to come back and answer. Alrighty. See you later, Miss Tammy.